Benita's going to do a little talking. Benita, I got 11:03. Are you ready to begin?
I'm ready to roll.
Excellent. I've made Dr. White the co-host. I'm going to stop the share on the screen and it will be all yours.
Thank you. Well, David has given me the time to do just a quick thank you, and this is a huge surprise to Dr. White, so surprise. There's no real formal introduction, but I wanted to take the time to say thank you to our Deputy Commissioner, one of the two physicians in my professional career that have made a huge impact on me, not only professionally, but personally, and I'm going to get through this without tears. But Dr. White is much more than our Deputy Commissioner for Clinical Affairs. Dr. White is everything rolled into one package. She is intelligent, she is kind, she is caring, she is genuine, she is honest, she is supportive. You could not have asked for a better Deputy Commissioner. Our Department for Public Health is blessed to have her in that role, and more importantly, I am blessed to call her a friend. So Dr. White, I'm going to turn it over to you. The floor is yours.
Well, that was the nicest introduction I've ever had. That beat my CV. Thank you, and I will make through this without crying too. So thank you, Benita. I guess this is your last task force meeting, and so I think I can put all those accolades back at you. You have been the heart of the program, and fortunately, you have found someone whose heartbeat you share with Lana. So we are so happy to have her with us, but you will be missed in so many ways, and I hope you won't disappear off of the face of my earth, because there's so much that we have in common and that we love, and one of them is public health, and the other is this cause. This is one of the first reports I read was your task force project that had to be submitted to the legislature, and I thought, wow, these people really know what they're doing here at this department. I was very impressed, and still impressed with all the work that you guys do, and the fact that you do this because this is what you love, and you just can't beat people who are passionate and take this so personally, because it is a personal. So many of us have been touched by this, heart disease and stroke. My mother's had a TIA, had a stroke in 2017. So it's important to all of us, and I do appreciate it. I do appreciate you letting me come today. I will go ahead and share my screen. Now better show up. There it is. I hate it when people do the old, oh, let me get this straight, and then they never seem to be able to get it straight. Of course, now I'm doing that too, and I bet I practiced this like 6 times this morning. So, and I'm trying to get this panel out of the way. Here we go. Yeah, see, I'm one of those people that is not very smooth at this. Okay. Now, can you see my screen? Yes, okay, great. All right, so today my task is to talk. I love the task talk. I think that's a great name. To let you know where we are in the Department for Public Health. I was all ready to give you a what are we doing in the Department for Public Health besides COVID? And then David said, nope, this is what y'all wanted to know. Where are we with COVID? So I certainly know a lot about that. We have been drinking out of the fire hose, as all of the rest of you have, since March the 6th. That was the March the 6th of 2020. Was when we had our first case, and we have been at this since then. So we'll just—
Dr. White?
Yes.
Oh, never mind. I don't know what you just did, but part of your slides were cut off, but now we are better. So
you're good? Okay,
ignore
great.
me. You're good to go.
Okay, so Department for Public Health, I have this slide that I show to people. I don't think I need to show it to you guys, because you know where you live in the prevention, quality improvement, and chronic disease prevention. I just show this. I like to tell people we are everything from tattoo parlors to whole genome sequencing. We do everything in between, and that kind of rolls up what we do. So it kind of gives you an idea, and I can tell you that every single one of these divisions was affected by COVID, and we don't have time or the interest to go into how, but it infused every piece of the Department for Public Health. This is, if you watch the governors, and I should have asked before I went on this just for kind of a show of hands, how many people have ever watched the governor's press conference? I watched them all because that's how we know what he's going to tell us to do next in the Department for Public Health. He keeps things close to the vest, and we find out, oh, we're going to start doing that now. Okay, good. So I don't miss the press conferences. They've been very educational for me because of all the other things besides what affects my world in the Department for Public Health. But this is what the governor calls the stair stepper chart. I call it the purple chart. Each one of the bars, can y'all see my pointer, David? Can you see
Yes,
my
we
point?
see it.
Okay,
Yep.
all right. Well, I didn't want to be pointing at something and realize you aren't seeing it. Each one of these purple bars is the number of cases in a week. And a week starts from Monday through the next Sunday. So you can see back here, March the 6th, we had an increase and we got all the way up to 1,000 cases a week, and we were just frantic. It kind of got stable. This is when we had our Healthy at Home initiative. We opened that up, opened up a little bit of things in the public, and we had this next increase. That's where we then the governor did the work that he did on restaurants and public gatherings, and then the mask ordinance came into place here. We had another flattening, and then the fall came, and we had lots of things happen. We had Derby, we had Labor Day weekend, we had Halloween, and then everybody lost their minds, and that's when we had this tremendous increase here in the number of cases. This artifact right here, that's the week of Christmas, so there were only 3 work days that week. So there was Christmas Eve, Christmas Day, then there was a weekend, and so a lot of labs weren't open, a lot of testing wasn't done, so this artificially happened here. This was our peak, and this was around the 1st of January. What happened also during this time right here was when we started vaccinations. And once vaccinations started, and if you can remember all the way back to December, it sounds like years ago to me, but we started doing vaccinations in long-term care facilities, and we started doing those vaccinations in those areas and people that were high risk, such as our healthcare workers. And that's where we saw our cases begin to plummet. We plateaued a little bit here through April and then went down again. And then, as you know, there has been that increase in cases. So we are back now where we were in April of last year. And this is where our caseload is right now. And we are continuing to see that go up. Not at an alarming rate, not at this trajectory, and I hate to use the word yet, but not at that trajectory yet. I just pulled this off of the website. If you have not been to kycovid19.ky.gov, every day there is a new map that goes up, and it shows you the incidence rate, a rolling 7-day incidence rate in your county. So you can look and see where your county is. This red county here in the next day or two goes away, but we had in Hopkins County, they had a church camp, and they had 15 positive cases. 100 people were quarantined because of those 15 positive cases. So that's why we do this rolling average, and you can see what your incidence rate looks like in your county. This is something that I thought, as medical providers, I don't usually show this slide, but I thought you might find interesting. Our positivity rate is gone from below 2% up to 3.38%. Last week it was 2.47. The week before that it was below 2%. And so what this shows, people say, well, y'all aren't doing enough tests, or you're doing too many tests. Well, what we're doing is the orange line is the number of average daily tests being done, and this is the average positivity of those tests being done. This slide right, this part right here shows you what the positivity rate has done over time. So it was extremely high back then in April of last year, but again, go back to April of last year, we had very, very little testing that we could do. So almost everybody that got tested was positive because we only we only tested the sickest of the sick. So that got a little bit more normal as we got more testing. Then it went up, and that corresponds to that peak we saw back in last fall and gone down. But now here you can see that little bitty upswing of the positivity rate. This is the death rate, and this is the date of death, not the date that the governor reported it, but the date of death. And you can see that this trajectory right here is about a week or two behind the trajectory of cases that we saw. And then again, you can see that death rate plummet after vaccination started. Now, you don't see many here, but as I said, we have a weekly group that meets and reviews COVID deaths. Some of the deaths will take weeks before we get the death certificate, before we get all of the medical records, before we even get reporting in some areas of the state. So this number will be higher over time, and because of the increase in cases we're seeing right now, we certainly expect to see in about another 2 to 3 weeks the number of deaths to start increasing as well. I will say that high 90% of our death rate, if not 99% of our death rate now, of people that are dying now, are unvaccinated patients. Just real quickly so you can see this isn't usually shared, but I pulled this off of an internal document, and that just shows you the blue line is the percent of the population in these different racial and ethnic groups. The red line is the number of cases, and the green line is the number of deaths. So you can see that in the African American population in Kentucky, 8.4% of Kentuckians are African American or Black. 8.3% of our cases were African American or Black, and 8% were deaths were African or Black. So a very similar distribution. A higher case rate in Latino and or Hispanic, and we think that the reason the death rate is so low is more of these were at the very beginning, and they were people who were working jobs where they couldn't protect themselves as well as we had wished that they could, and they were younger, so we didn't at the beginning of the pandemic see as high of a death rate. What is missing from here is our unknown race. That and missing, that's a whole conversation to have sometime. We have had one heck of a time getting people to declare their race and ethnicity. Unfortunately, our patients don't think in the same set of boxes that an epidemiologist thinks about. So when we would ask people, in one particular example was one of our counties, on the paper form that we were doing at the very beginning, race, the person said they were Hispanic. And so the interviewer said, no, Hispanic isn't a race, that's an ethnicity. What kind of Hispanic are you? And finally, the person said Catholic. So people don't think in the boxes of Black Hispanic, Black non-Hispanic, white not. We have all those categories in our head. So we have no way of knowing these 72,000 missing or 317 unknown races. We don't know where to put them. That's going to be a conversation we're going to have going forward for all of our data collection and all of our surveillance. This shows you the same blue, red, and green line by age. And so you're seeing that almost half of our deaths were in 80 and over. And as you get younger, that goes down. We are, however, beginning to see more deaths. The group that I reviewed yesterday, there was a 34-year-old and a 42-year-old and a 51-year-old. Of deaths from COVID. So we are seeing younger and younger people now dying, but the older group, my age group, over 60, have been protected with vaccinations, and we're not seeing as many deaths as we did earlier. This, I think, is a good visual to show you what the inpatient census was from COVID-19, what our ICU census looked like, and our ventilator census. And again, if you look at the end here, after July the 1st, you've got that little blip going up. You've got the ICU census blip going up, and unfortunately, you have the ventilator rate going up, just as it reflects in the numbers of cases that we showed. This is an interesting map. there are a lot of things that we wanted to do in the Department for Public Health when this pandemic started. Some of our bigger causes were we wanted to protect our healthcare workers, we wanted to protect our hospitals, because we have seen pictures and we have seen plenty of information that shows what happens when a hospital reaches capacity, when the hospital staff reach their capacity. So we started watching this map, and this is by hospital regions, or regions that we use in our preparedness. And we were looking at ICU beds, inpatient beds, and ventilator beds. And this district right here, this region right here, they only have about 47 ICU beds in that whole region. So that region turns red most frequently, and we call a red region somebody that's over 80%. So this has been holding pretty steady. We'll be watching this carefully to see if we see an increase in more than just that one region. This is just a visual for you to see vaccinations in Kentucky. 4 million vaccinations plus. This is from the 12th, so that doesn't count any of the vaccinations from this week. 4 million vaccinations total. 2.2 million unique individuals have been vaccinated in Kentucky. You can see how that vaccination rate, and if you were one of those people that were up all night trying to get on a website to get a vaccination, you remember what it was like back here. We have continued to see an increase, but that has certainly doesn't have the trajectory we would like to see. And this is a breakdown by age group of where those vaccinations are. The next slide shows that a little better, but we do have 83% of people over the age of 65 have been vaccinated in the state of Kentucky. I'm pleased it's that high. I hope we can make that a higher number. I'm giving you this slide, but I'm going to show you where those links go. I can't click on that and get you where that is for some reason. That's my own skills at making a PowerPoint, but I'll show you what I did. A screenshot of what those two websites look like, and David, please send this out because there's nothing secret on this PowerPoint, and you can go to copy and paste that in your browser. This is what you would see on that first link, and this again shows you all of the vaccinations by age, and there's a huge number of unknown. Now, I don't know how people don't know how old they are, but that's a different data collection story. But this is showing you by age where our vaccinated individuals are in the state of Kentucky. The breakdown, and since this is such a small group, one of the reporters asked the governor, so why are more women than men getting vaccinated? Are women just smarter than men? I thought that was pretty hilarious. We have 5,800 that we don't know their gender, and I don't know if that's a gender identity issue or someone just didn't write down that information. This shows you a breakdown by race, and I'm looking, I think this is probably the Native American, and I think this is probably the American Indian group, but you can see Asian, Black, African American, this is the other, this is the unknown, and then this is the white group. This is a really nice site. If you haven't gone to this on our Kentucky kycovid19.ky.gov website, and this is a dashboard that shows you a lot about vaccinations in the state. It shows you the top 5 counties for vaccination. I keep telling Woodford County that we're coming after them. I live in Franklin County, so we're very, very close. But then, like I said, we just had a cluster outbreak in Woodford County. Woodford County, for those of you who don't know, is right there. Franklin County is right there. There's Fayette. There's Taylor County, my home county, because it's shaped like a heart. We'll talk about that in a minute. So these are the highest vaccinated counties, and these are the lowest vaccinated counties. It will show you, again, what we showed earlier, percent of the population by age, and then the actual numbers. On the left-hand side, it shows you the uptake of the vaccines. by type, Moderna, Pfizer, and the Johnson & Johnson. So the next slide, what I did was I hovered over Taylor County, and when you hover over one of the counties, it will give you the county name, the county population, the SVI ranking, and then it tells you 10,500 have been vaccinated. One of those is my mama. The percent of the population that's been vaccinated, and on down. So you can see that for every county in the state of Kentucky. I don't know how many of you are old enough to know what this little girl is looking at, but I have a very good memory of getting my sugar cube, the vaccination for polio. This was a very compelling story for the public health world to put out there as to why we needed that sugar cube vaccination. And for the younger ones of you, the little sugar cube here had 3 pink dots on it. That was 3 dots of this solution in this in that little eyedropper there. And that's how we were vaccinated against polio. And I liked this picture because it wasn't just the kids getting vaccinated, it was the families being vaccinated. And this shows how I distinctly remember standing in line in downtown Campbellsville. It was a Sunday afternoon. I was just thought it was so cool. We were doing something on Sunday because that was back in the early 60s and nothing was open. Restaurants weren't open, gas stations weren't open, nothing was open. And we were all lined up down Main Street, all getting our sugar cube. What a difference the world has made since the early 60s when that sugar cube vaccination helped us to wipe out polio. Vaccine confidence, I just wanted to touch on this real briefly. These are some slides from the CDC talking about the trust that is necessary and how important it is that you as a healthcare provider are recommending these vaccines, being willing to administer the vaccines, and having policies in place to be sure that this is something that you're doing across the healthcare system that you're working in. These 2 surveys that I just found shocking, and go back to that picture I showed you where everybody was standing in line to get their polio vaccine, that 63, this is amazing to me, 63% of the nurses they surveyed in October of last year said that they thought the vaccines would be safe and effective. So this is before it was released, and so you have to give them credit that they were talking about an unknown, but 63% thought it would be safe and effective, but only 34% of them would volunteer to receive the vaccine. I just found that very shocking. The people that were on the front lines watching the destruction that this virus was causing, only 34% of them would voluntarily receive the vaccines, and only 57% said that they would be comfortable. I don't know that they've repeated that. It would be very interesting for me to see after the vaccines have been released and the decrease in the number of cases and death we've seen, would that still be the same answer? But I found that very surprising. And then this was a CDC website for healthcare providers in general, not just nurses, where 63% said that they would agree to get the COVID vaccination. So we have to be ready. I didn't pull all the slides that are on this presentation. People were, they get their information, and now everyone has a doctorate in epidemiology from UFB, the University of Facebook. So people seem to think they know a lot more than they know. They do their research, which that just means looking stuff up. So making sure they understand that they can't get COVID from the vaccine. If you've already had COVID infection, it benefits you to get the vaccine. Your immune response will be so much higher. It does not guarantee you'll never get COVID, but it certainly decreases your viral load. So your ability to get sick is less, and your ability to spread it to someone else is less if you've been vaccinated. It won't cause you to have a false positive test. And then there's a whole series of slides. I just wanted to go through these questions so we could, if there's anybody has any questions to me as to how to best answer this. How do we know if the vaccines are safe? I think the best way I've described it is the process that went through this development of this vaccine cut the red tape for getting everything started. It did not cut the the quality, the testing, and everything that went into assuring the safety and efficacy of this vaccine. Is it safe to get a vaccine if I have allergies? Well, it depends. You know, I have a lot of other kinds of allergies, but yes, you can get this vaccine unless you have had significant reactions to the reagents that go into a vaccine. Can I get vaccinated if I'm pregnant or breastfeeding? Full disclosure, I practiced OBGYN here in Frankfort for 20 years, so I'm very comfortable telling people if you're breastfeeding, yes, please go ahead and get vaccinated. The antibodies do pass through the breast milk, and it will give some protection to your baby. We also know that the antibodies do pass through to the infant through the placenta, and any viral, respiratory viral illness is dangerous for women who are pregnant, and I think it's very important, and were I still in practice, I would be recommending this to pregnant women as well. Yes, has it been tested on different populations? Yes, there was a great effort to spread the testing around different races and ethnicities. Will the shot hurt? Well, I didn't feel them giving it to me. I had a little after the second, I got the Moderna after my second Moderna shot. I was on the couch for a day, and I was fortunate enough I got mine on a Friday. So by Sunday, I was good to go. So those are some of the major questions that are in the CDC presentation. You may have other questions that we might want to talk about today when I finish here, and I'm just about done. Please assist us with this survey. And I put a hyperlink into this. I think I did this right, David, that you would be able to click on this and give a short survey. It takes 5 minutes. It's been put together by our clinical educator, Dr. Amy Harrington, and I even wrote down what she told me, and of course I couldn't find it in my notes this morning when I was trying to pull this together, but I believe she said out of the almost 600 responses she's gotten to this, only 5% were from physicians. So if you could please share this survey with anybody that you're working with. If it's quality improvement folks, that would be under other. There's categories that ask you what kind of healthcare work do you do. But we would greatly like to know this information so that we're sure that we're planning our interaction with the public and with the healthcare providers correctly. This is my website information. If anybody has questions, of course, David can find me, Lana can find me, but we want you to feel very comfortable asking us questions, because if we don't know those answers, we know how to get them, or we know how to find them for you. So that was a little bit longer than I meant to talk, but I am available for questions and are happy to interact. Thanks much for your time.
Thank you, Dr. White. That was excellent. I appreciate all that. You will share the PowerPoint with me?
Absolutely.
Excellent. So I will share the PowerPoint on our website. I will send up a follow-up email next week and let everybody know when the resources are available. I will put a link to the PDF and the website that you highlighted in your presentation.
Okay.
And the follow-up email, I'll make sure has an actual direct link to the survey that you just shared, so they don't even have to go to our website if they don't want to. We want them to go to our website, go get the slides, but I'll get that right to them. So,
great, thank you.
Does anybody?
And thank you, Kathy, for watching nearly all of them. I will tell you that I have been in the Department of Public Health for 12 years. I've never seen a commissioner get fan mail. It has been hilarious. Dr. Stack has a whole shelf in his office. He gets gifts. He says he appeals to the 6-year-olds and the 86-year-olds. So he gets the cutest letters from little kids, and then he gets these lovely letters from little old ladies who watch all of the press conferences. I think we've stopped having bourbon with Bashir at 5. I think that's kind of stopped now that he changed them to 4. But yeah, Dr. Stack gets some really interesting emails from people that watch the press conferences. Hi, Gina. I see you down there. So questions on I mean, on anything, I'm not going to say I know the answer to everything, but like I said, I do know how to find the right answers to people. And I will let you know that as of 10 o'clock this morning, DPH released our guidance for school reopening. And if you go to the covid19.ky.gov, I can't believe I didn't make a slide that said that. If you go to that website, there's a box that says K through 12 resources or something like that, and it's posted there. It was posted at 10 o'clock this morning. It pretty much is a summary of the CDC guidance for school reopening, and it has links to take you to the actual CDC guidance. As we've said all along, unvaccinated people should mask. That is going to spin a lot of people around on their axis, but if you're not vaccinated, you need to be masked. So we'll see. For you guys can help us here. The Department for Public Health does not have any authority to tell a school system what to do. The Department of Education does not have the authority to tell a local school system what they have to do. We have local control in the state of Kentucky. So I am getting email, the superintendent at Jefferson County Schools was threatened with a gun because they did not want to mask their children going to school. And Jefferson County says if you're unvaccinated, you will have to be masked. I've gotten 3 emails this morning already from local health departments saying, what do you mean you're not requiring masking? We're going to be right back where we started from with illnesses. Can't you make this happen? We can't make it happen. It is the way the system is set up.
Thank you, Dr. White.
My stepdaughter tells people I'm the Tsarina of public health for the state of Kentucky, which I wish I was, because I would have a throne, a crown, and a big scepter that would be very heavy, and I would whack people to get them to do. A magic wand would be too light. It would be very substantial. I can't do that. And all we can do is give people information, guidance. Some of the stuff we're doing, I read an article last night that we're in a fact-free, evidence-free zone in some of this. And when people complain, well, y'all keep changing the rules. More evidence comes up and gives us the information to change some of the rules. But guidance is the best we can do. And people like you that are the trusted individuals in your communities can help spread that. Okay, David, now I am really done.
Oh, okay. No, you keep going. I was just going to say, you keep mentioning the website. I will make sure there's a link to the COVID website on our website when I share it. And for anybody that's received any of the news and notes from me over the last year and a half, go back to one of those archived issues, and that link has been in there to the COVID website. So
and I just put it in
all
the
out
chat.
there.
I
Perfect.
Just put it in the chat,
Excellent.
So. A lot of great information on that website.
Dr. White, this is Cindy Sullivan. Hi. I wanted to ask you, I may have missed it, I was just a few minutes late joining, but what percentage of new cases are the new Delta variant here in Kentucky?
Well, that's a great question, and the answer to that is we really don't know. We don't sequence every positive test.
I see.
It's expensive.
Mm-hmm.
It takes about 2 days to do it. And so there's 2 ways that your test gets sequenced in Kentucky. One is the CDC has arrangements with laboratories all over the United States. So they have arrangements with certain laboratories in Kentucky that send them a predetermined percent or segment of their positive tests they send to the CDC. And the CDC laboratory, which is much bigger than our laboratory, sequences those and says, okay, Colorado has this percent, Kentucky has this percent. And so that's pretty much the way we figure that out. Now, in Kentucky, we have been going above and beyond that when we have breakthrough cases, and a breakthrough case is someone who is positive, but they have been fully vaccinated.
Okay.
So we're looking at those. We have, sometimes when we have a cluster, we will look at those. The bottom line is we don't do that. So if you sent me a specimen and said, I want this sequence because, you know, Charlie Rose here in my hospital is positive, you're not going to treat that patient any differently. And the way I was taught is, don't order a test if it's not going to change your treatment plan.
Right.
You know, you might be curious, it might be interesting. The other problem is, if you send that to the state lab, excuse me, if you send that to the state lab will not tell you what the sequencing of that specimen was. We're not allowed to do that. So
Okay.
as a provider, you're not even going to get the results anyway.
Okay.
So we have Delta variant in Kentucky. The fact that our cases are going up tell me we have more than we think we have.
Mm-hmm.
But the complexity, the expense, and the fact that you're still going to treat the patients the same way, it's not something that we're able to do this sequencing for everybody.
Okay. Okay. Thank you.
It's a good question. Oh, and boosters, since nobody's asked about that, I'll throw that one out there, because my mother, God love her, she's 91. I went to see her Sunday, and she said, now, am I supposed to get my booster 6 months after my first shot or my second shot? And I said, you've been watching TV again, Mom. We don't know about boosters. What they're doing is they're looking at the people that got that were in the studies last spring. They're watching their antibody levels. They're watching their clinical history, and they're watching to see, is there any waning in those antibody levels? And from what we're told at this point, that has not happened yet. Now, what we've been pushing, and Dr. Walensky was on a call that I participated in last week, is would they give guidance to providers such as, if you are a solid organ transplant patient, should you get a booster? Don't know. I mean, again, we're in that fact-free zone. If you have an autoimmune disease, if you know, there's a whole host of reasons that physicians are going and are saying, well, it kind of makes sense they might need a booster. We don't have that information yet, and the CDC is working on that. So I'm hopeful that they will send out some very specific guidance of who might need a booster, but there is no recommendation for booster at this time, and they're ongoing watching it to see, is the response waning, and if it is, then that's when we will announce that.
Well, that leads me to my next question.
Okay.
And that is, you know, you're hearing so much about which vaccine you took and which is more effective against the new Delta variant. What part of that is true or is not true?
Well, they're all effective to some degree against the Delta variant. They're not as effective against the Delta variant as they are against all those other variants that we had. And y'all get a kick out of this. This is, I wasn't in a sorority, so I went online and I printed out the Greek alphabet, because once you get past Delta, I can't write, Epsilon's next, and then I can't remember any of them. So I don't know where we are in our variants yet, but right now, every variant that's been identified has some response, or all of our vaccines have some response to that. And let's just hope and pray that continues to happen. And I'm sorry, Cindy, I've already gone Zoom dead. What was your question about the variant? Oh, which one is the best?
Which one is the best? Yeah.
Yeah, you know, the best one is the one that you'll take. That's is my old OBGYN training. You know, what's the best contraception? The one that the patient will use. So if you can get a vaccine, you get that puppy as quick as you can. It will protect you to a large degree. Nothing protects us from everything. And then you got people like my husband, who's fully vaccinated, but he's decided to start wearing a mask, because when he wears a mask, people think he's not vaccinated, and they leave him alone. And he thinks that is just the best thing that ever happened, that he can go out and nobody talks to him now because he wears a mask. So for the introvert in your life, this is just heaven. Anything else?
Excellent. Dr. White, I have a question that may be slightly off topic.
Oh, please.
With the vaccine hesitancy as it is, and with fall coming up, where is flu going to play into our lives?
That is a great question, especially with our cardiac patients. If y'all think back, you really didn't see much flu last year because people were wearing masks and they were washing their hands and they were staying away from each other, and school wasn't in session because kids are just little flu petri dishes. And so we had a lot of things that kept us from having flu transmitted. So the best thing that came out recently is when they said that you can give COVID vaccine the same time you're giving a different vaccine. You know, initially they said, oh, no, you got to give that and wait 2 weeks and all of that nonsense. And it wasn't nonsense at the time. It was a evidence-free zone. But now they know that they can be given together. So it's important that as kids and adults get vaccinated for COVID, yes, please get that flu shot. I was in a meeting with some long-term care folks, and this was, and again, this was not representative of the long-term care world. This was just an observation by someone who said, we didn't have anybody die of flu in our long-term care facilities this last year. Every year we go, oh, it's flu season. Old people die. You know what? They don't have to. Are we going to see long-term care facilities start saying, oh, it's flu season, and we're going to have everybody in our long-term care facility wear masks so people don't die of the flu? I thought that was a really interesting observation, and the way to take, you know, we're public health. We put lipstick on a pig. You know, something goes bad, we're going to figure out a good thing to educate people on and inform people about. You know, maybe we will see differences in our long-term care facilities. I've got a 100-year-old aunt that I went and visited last weekend, and she doesn't have to die of the flu if everybody does what we know you need to do to prevent vaccine infection spread. So maybe we will see less flu this year because people know, or they've had evidence to show them how they can prevent that from happening.
So Dr. White, this is Carrie Moore. I apologize. I don't
Carrie?
have I'm traveling today. I'm actually driving, so I apologize for not showing my face, but I appreciate that information.
Carrie took care of my mama when she had her stroke, so thank you, Carrie.
Well, what I hear from your genetics and your heritage there is that you're going to be our deputy commissioner for 20 more years, with everybody living to be over 100. So we're in good shape, I think.
Yeah, Mama's only 91.
Yeah, but your aunt's 100, so we're good.
Yeah.
My question is more of a practical one. Mm-hmm. I'm still advising my patients that are immunocompromised and vaccinated to wear their mask because they're a little hesitant. And you know, we do know of people that are even vaccinated that are, of course, contracting COVID. And with the Delta variant, would you do the same? I mean, I understand that we're saying if you're vaccinated, you don't need to wear your mask, but I honestly feel like we're just not sure.
Well, I agree with you 100%, Carrie. I don't go into Kroger's without my mask on.
Okay.
I have rheumatoid arthritis. I take methotrexate. My husband, the antisocial one, has no health problems at all. But both of us, if we go into a closed place, we are still wearing our masks because it's just not that hard. You know, I was an OBGYN physician for 20 years. I spent as much time in a mask as I did without a mask. So it is not that, it's not like giving a left kidney. It's a mask and you can wear it. So I absolutely agree with you. I think you are doing them a service by saying, we just don't know. So why wouldn't you do that just for that extra protection? So I agree with you 100%, Carrie. You know, any of your patients that have, I mean, every Wednesday from 1 to 2:30, I'm looking at COVID deaths, and I'm looking at very fragile people that it kicked them over the edge. They were old and they had medical issues, but they were cruising along with their life, and this was just more than they could bear. Why could we not mask those folks to prevent them from dying?
Okay, I appreciate it. Thank you.
Thank you.
Dr. White, I have one quick question.
Yes, Cindy.
I have a 9-year-old in the house, and we have continued to mask whenever we go to places like you mentioned. But we were in Florida last week, and we were in a condo, but everyone, the adults in the condo were all vaccinated, but the 2 children were not. So what I noticed is like your husband said, people stayed away from me because I had my mask on.
Exactly. Yeah. You know, you're in a room or a condo where all the adults are vaccinated. I think you can feel comfortable with your kids, but when you go to Costco or Kmart or, you know, you don't know what, and you can't ask because people will get their knickers in a twist if you ask them. So you just wear your mask. It's very simple. I keep one in my purse at all times. I've got one hanging on the turn signal on my car. And of course, if you're careful, you can accessorize with your outfit so that it matches. I mean, I'm all about that, and Lana and Benita are laughing, but yeah, there's nothing wrong with wearing a mask. I just think it shows good judgment.
Thank you.
Dr.
White, this is Carol Falcignani at Norton Faith and Health Ministries. I had a question. We have very, very deep relationships with some of the faith communities in the Louisville metro area, often in some of the more challenged neighborhoods. Do you all have any experiences that you could share that might be unique ideas to help us overcome some of the trust hesitancy issues that we've experienced? Thank you.
Well, those are great comments, Carol. You know, you can't build trust overnight, as you know. And so probably what I think one of, and I'm not here doing a Bashir commercial, but I think one of the smarter things that the administration did was back in February, I don't know if you remember, but he brought a whole group of faith leaders into the Capitol Rotunda, and they all got vaccinated. And there's just nothing like having the pastor, the imam, the rabbi, whatever, who is your leader, who you look up to, saying, I did this to protect you and to protect others in my congregation or my group. And so, and we all know if you can get the lady that runs the church to get her vaccination, that will go a long way as well. So rather than trying to convince everyone, which you're not going to, but getting and you know this with the work that you've done before, is really trying, and I love one of the pastors said when they interviewed him, he said, we're going to be done with this. We're going to be done with this together. I want a t-shirt that says that, not that we'll get through this, but we're going to be done with this. And that was the message he had for his congregation. So we've done a lot of work, and I didn't even get into this. We've gotten a lot of funding to do, things that I only dreamed we'd be able to do in public health through our vaccine equity funding that we've gotten. We're doing a lot of work, Gina, with community health workers, as you know, meeting people where they are. People don't come. We can't expect everybody to come to us and get what they need. We have to go out to them, and that's through community health workers, and that's through the faith community. All of those different things is getting those trusted leaders to get the message. That's who's going to listen to the message, not because Connie White said so. But have you had any contact with Vivian Leslie Bibbs, Carol, our health equity person here in the cabinet?
In the past, but not recently.
Okay, well, we need to be sure that she's communicating with you, because we have a cabinet-wide vaccine equity group that meets every week, and we've got folks from aging, and we've got folks from disabilities, and we've got folks from social workers from DCB. I mean, it's a huge group that's turning over every rock that we can think of how can we get door to door. I know that's a bad word now, but door to door has been very successful for people who haven't been able to get access. How do we bring mobile units into a community? So with your outreach, we definitely need to connect with you. So thanks for bringing that up.
Yeah, we in February, March, and April, we put over 6,200 shots in arms in faith communities with working with our Norton Medical Group and our Norton Prevention and Wellness folks. But the interest seemed to wane, and we still need to continue trying to make a difference. So I look forward to this opportunity. Thank you.
Right, and Norton Wellness folks are, I believe, are part of that bigger group. So,
Okay.
but I'll be sure that we have have Vivian reach out to you, Carol.
Yeah. Thank you.
Thanks. Anything else?
Do we have any other questions out there? All right, if we have no other questions, I want to thank you, Dr. White, for joining us today. It was an excellent presentation. Yes, thank you. I did that. That was my foreign language at UK.
Oh, really?
Was sign language. Yes, I don't remember tons of it, but I can still introduce myself,
Thank you.
tell people what I do, that kind of type thing. But it's a process. But anyway, thank you for being here. If you send me the PowerPoint, we'll share that with everyone. Carol, I will connect you with Vivian as soon as I get off of here, and let you follow up directly with her. And yeah, Benita, do you have any last words?
No, just thank you. We appreciate it very much. It's always a pleasure to hear you talk, and how much you bring to any conversation I always learn something. So thank you.
Welcome.
Excellent. Well, thank everyone for joining us. Our next Task Talks is going to be in September. I am actually having a meeting tomorrow to work on some of the details, but we're going to have someone from American Heart Association talking about advocacy. I don't have many of the details. Like I said, I'm meeting tomorrow. I don't even have a date yet, but you'll hear from me soon about it, but it will be sometime in September. So otherwise, everyone have a great day. Enjoy a little bit of the beautiful weather before the rain comes back to us. And thank you for joining us.